Hi viewers, today we'll see nursing care of patients with amputation. I am Dr. Kaliselvi Xavier, Professor in Tribhulam College of Nursing. Objectives. End of the class, the students will be able to describe the history of the amputation, ensure the meaning and definition of the amputation, list down aim and causes of amputation, enlist the levels of amputation, explain the pathophysiology of amputation, describe the diagnostic test of amputation, explain the pre and post operative measurement, explain how to do the dressing after amputation, enumerate about care of limb after amputation, describe the phantom pain after amputation, explain the nursing intervention for amputation, specify the complication may occur after amputation, mention the rehabilitation procedure of amputation. Though one of the surgical intervention of life-saving procedure is amputation, many of the patient is young or old age, the acceptance of the procedure is very complex and difficult. So the nurse should take important role in this, explaining the procedure and taking care of the patients. As introduction, amputation in medicine, removal of any part of the body. Commonly the term is restricted to mean surgical removal of part of or entire limb, either upper or lower extremity. The reasons may be injury, infection, tumor, diabetes mellitus, insufficient blood supply. As history, the Greek physician Hippocrates of Kos in Pieces or Treatises on joints wrote the first description of amputation for vascular gangrene. He also described removal of blanket tissue at the joint above the area of demarcation and auto amputation. Meaning amputation means in Latin it is a amputure. Amputure, it is a cut off, cut away, derived from amp, about the puter or prune or lop, to lop. The verb amputere was explained to cutting of the hands of criminals. Now we'll see definition. Amputation is the removal of limb, part or total from the body. Otherwise we can say disarticulation is removing the limb through a joint. Generally the amputation of lower limb are common than those of upper limb. Statistical data regarding amputations. Regarding 82% of amputation are due to vascular disease, regard to 22% of are due to trauma, with regard to 4% are due to congenital defects, and considering 4% are because of tumor. Aims. What are the aims for amputation? To save life where the leg become gangrene or malignant or it is spreading, like that means we can take immediately the patient to be amputated. To preserve as much viable healthy limb as possible, to relieve symptoms, to improve functions of the patients, to improve quality of life. What are the causes of amputations? Progressive peripheral vascular disease. Maybe the patient is complication of diabetes mellitus, trauma, crush injury, burn injury including electrical, frostbite, chronic osteomyelitis, gas gangrene, malignant tumor, congenital deformity. What are the levels of the amputation? The aim actually is to conserve as much limb as possible and to reserve joints. Surgical at the most distal point of limb which will heal successfully. Depends on circulatory status of extremity and appropriate level for fitting prosthesis, the area will be selected. In regard to pathophysiology, the removal of the body extremity by trauma or surgery as prognosis, the surgical measure it is used to control pain or a disease process in the affected limb, such as the patient is having malignant or gangrene. In some cases it may be used as a preventive surgery for such problems. In the Islamic countries, Amputation of the hands and feet is sometimes used as a form of punishment for criminals. And also, some of the cultures and religions view amputation as ritual accomplishment. What are the diagnostic tests to be done according to the patient condition, serious history? We have to see other investigation, but the main investigations are CBC is done to determine any blood discrepancies like anemia, bleeding tendencies that would influence the outcome and increase complication both during and after surgery. And also very important to see ECG to determine any cardiac dysarrhythmias. This is the one of the example for the patient affected with diabetic foot ulcers, the normal skin and skin which is affected by ulcer. So we have to educate how to take care of the limb. The other case, other example, the peripheral artery disease. Due to the peripheral artery disease, okay, the ischemia, the leg become gangrene, non-healing ulcer. In pre-operative assessment, age of patient, we have to see the patient is old age or middle age or the young old. We have to see according to the general health, other health history to be assessed. What are the other current medications the patient taking, any diabetics, hypertension like that, we have to rule out. Psychological impact, the patient level of psychological factors, acceptance, we have to consider circulatory status of the affected limb, how it is that the Doppler flow meter to be checked, and the BP also segmented BP to be monitored, and transcutaneous partial pressure oxygen to be checked, and also related to muscle and joint function to be assessed by physically. What happens during amputations? If the surgeon must remove the diseased limb but preserve as much healthy skin, blood vessels and nerve tissues as possible, because if the surgeon removes too little tissue, wound will not heal because unhealthy tissue remains and the circulation is impaired. So if the patient have a traumatic injury, the surgeon will remove the crushed bone and also other damaged tissue also. Once surgery is complete, the team may place a stocking over the stump to hold drainage tubes and wound dressing in place. Okay, the limb may be placed in traction or the splint, just depending on the situation. When the patient is coming to the recovery to the ward, the wound drainage to be monitored by the nurse and also stump to be observed, okay, and the dressing and all to be monitored. This is in the OT, how the team of the members working into the OT for during the amputation. Next we will see post-operative nursing care. The nurse we should observe the all the vital signs, including hydration level to be seen, nutritional status of the patients, because they are no stressed and depression, they won't eat properly, aseptic techniques, hygienic method, monitor wound healing, presence of edema, infection, skin breakdown, monitor for other complications, wrap or cover the injured area with a sterile dressing or clean cloth, tourniquet available in case of severe hemorrhage, the patient that to be observed whether oozing, assess mood of the patients, elevate the injured area, apply pressure if the injured area is bleeding, gently splint the injured area to prevent movement or further damage. Here also mentioned about dressings. As general procedure, we have to see the dressing and observe the any oozing on the color of the thing, everything in that previous dressing pad. Okay, we have to, before discard we have to observe, then elevate the stump for the first 24 to 48 hours. Okay, we have to observe, then move and turn the patient gently, slowly to prevent severe muscle spasm. Okay, we have to reposition the patient every 2 hourly, turning the patient from side to side and prone also if possible. What are the care of limb after amputations? We have to see for edema. Okay, whether it is a delay wound healing, we have to observe, elevate the limb, avoid placing lower limb on pillow. Okay, if risks flexion contracture of hip joint, rather raise foot of bed. Okay, constant pressure bandage, that will be molds stump for prosthesis. Range of motion exercise, change of position, that and all very much helpful for blood circulation. Strengthening and exercise to be done, and molds muscles of stump. Okay, prevent the flexion contracture of joint. How the phantom pain will be there? We have to assess pain score. Phantom limb pain occurs in 50 to 80% of amputees. The feeling or sensation that the limb is still attached, causing burning, tingling, itching, and pain. There are no meds specific for phantom pain. The doctor may try a combination of pain medication, antidepressants, and counseling. Monitor for phantom pains, and massage of the stump to mold for prosthesis, and desensitization with transcutaneous electrical nerve stimulation, local anesthetic, and beta blockers medication, if necessary, can be administered. What are the other important nursing interventions? The first one is allow the patient to express feelings of mutilations. Okay, grief and anger. What are the thinking, thoughts? Okay, what is her future? He may think, he or she may think that. We have to listen and explain about the other alternative intervention for the patients. Encourage patient to help with dressing changes. Turn and position patients by secondarily. Teach adduction and extension exercises. Arrange for social service consultations. Family and patient education is very, very important about food and regarding the continuous of the patient routine care. What are the complications of amputation? Hemorrhage, infection, skin breakdown, delayed healings, phantom limb pain, joint contracture, severe depression and grief over permanent loss of limb, altered body image, and a modification of lifestyle. What are the rehabilitation program include? Treatments to help wound healing and stump care, activities to improve motor skill, ADLS, activities of daily living, and help the patients reach maximum independence, exercise to promote muscle strength, pain management to assess the pain score, and according to the choice or the physician order to be given, use of assistive devices, walker like that to be given, nutritional counseling to be given, patient and family educations. These are all the reference.